Hi, my name is Jamie Dicker, and I'm the videographer for this speech, and here is our audience.
In the United States, about 14 cases of Henoch-Schönlein purpura, also known as HSP, occur per every 100,000 school-aged children, according to the National Organization for Rare Disorders. Hi, my name is Carly Peters, and I happen to be one of them. Today, I'm going to be discussing the little knowledge that doctors and nurses have about this uncommon disorder. Henoch-Schönlein purpura, also known as HSP, is a very severe yet uncommon autoimmune disorder. The symptoms consist of bleeding blood vessels, which is the cause of a reddish purple rash on the outside and inside your body. It looks just like this. Pain and swelling in the joints, sometimes so bad that you can't even walk. Abdominal pain and possible kidney problems. Doctors and nurses need to become more knowledgeable when it comes to uncommon illnesses, just like this one. According to Improving Diagnosis in Healthcare, diagnostic errors persist throughout all settings of healthcare and continue to harm an unacceptable amount of patients. That is exactly what happened to me. The beginning symptoms started to show, so we decided to go to an urgent care. At the urgent care doctor took a quick glance at the rash and the swelling and assumed it was an allergic reaction caused by grass, bug bite, or my soccer shin guard. So he provided an anti-itch cream and gave me a steroid shot to help the allergic reaction. After a couple more weeks, we noticed that my symptoms had progressed and more appeared. Furthermore, we sought further medical experience. We decided to go to my pediatrician. My pediatrician was one who actually diagnosed me with HSP, and she prescribed me 5 milligrams of prednisone. After a couple more weeks, we realized that I had been severely underdosed. So we decided to go to the ER to get a higher dosage of steroids. At the ER, an ER nurse had to ask my mom how to spell it and what it was so that she could Google it. Since I was feeling nauseous, they gave me medication to take with the nausea, Zofran. Since the nausea went away, they sent me home. When I talk to my doctors nowadays, they tell me that I should have immediately been admitted to get a higher dosage of steroids. That is not what happened. According to the Mayo Clinic, HSP is only supposed to last up to within a month. Not in my case. I'm not the only one who had a bad experience. In fact, there are thousands. One little boy in San Antonio was diagnosed with HSP. Every time they went to the doctors, they kept getting answers like, I don't know, or he'll be fine. An 8-year-old boy in England was diagnosed with HSP. He was in his 7th week, and according to Dr. Pawan Kadi, HSP is only supposed to last up to a few days or a couple of weeks. A 13-year-old girl in Nottinghamshire's doctors took about 4 weeks to find out that she had HSP. They thought that she had appendicitis, so they took out her healthy appendix. She went through an uncalled surgery because her doctors didn't know what she had. All of these examples prove that doctors lack the amount of knowledge that they needed. Overall, I think doctors and nurses need to become more knowledgeable when it comes to uncommon illnesses. I recently took a poll on a Facebook group for HSP patients, and these are my results. My results were 75% no and 25% yes. As you can see, it kind of works in my favor. This disorder is so uncommon that these highly educated doctors that went to medical school don't even know how to treat the rarest of cases. I have faith that these doctors will soon find answers with the facts that they have now. Thank you. Does anyone have any questions?
For this disorder, is it like hereditary or like just a mess-up in like the genes or something?
Well, we don't actually know that. They know that it's caused by an infection in the respiratory, so that's what kind of sparks it, but they don't really know why it's caused, but that is a theory though.
Aside from the steroid treatment, are there other types of treatments such as diet or any kind of natural treatments that help this disorder?
Yes, there are some like that. And another popular medication is Dapsone. That is what I was diagnosed about 3 months later, and it helped drastically.
Do you have like any resentment towards the doctors that didn't know enough?
No, because I understand that it's I understand that it's very uncommon, and I completely understand.
You mentioned that it's an autoimmune disease, so are there lasting side effects? Can it reoccur later on?
Yes, it can. If you get sick again, like a flu or a stomach bug or something like that, it usually sparks a relapse.
How long were you sick, like in total?
About 5 to 6 months.
How did it affect your like daily life?
It affected drastically because I was not able to go to school or participate in my extracurricular activities.
So what are you doing today to prevent this disease from coming back?
I currently take a medication, Dapsone, as I mentioned before, and it helps kind of keep it back. So,
Will it get better as you get older? Will you grow out of it? Or will
Yes.
it something? It
yes,
will be. That's
I've currently grown out of it so far, but there is a chance that it could reoccur in the
Perfect.
future.
What's the major age group that it affects?
Usually in kids between 2 to 5. So it's very uncommon that it happens in a 13-year-old like me.
Thank you.
Thank you.